Dr. Iris Shaffron talking with Iris Torres, who really is amplifying the real problem with inflammatory bowel disease, and that is we have effective biologic therapies to treat patients, but a healthcare system that cannot afford and or patients to afford the cost of these medications. As a result of that, currently the FDA has allowed the biosimilar drugs to come to this marketplace. And I've written in the Gastroenterology Endoscopy News an article basically saying that we really don't know about whether or not these biosimilars are actually safe and effective for our patients. A recent study, a switch study presented in ECHO at the European Consensus organization that does all the presentations for inflammatory bowel disease, showed that switching patients from the parent drug to a biosimilar can be hazardous. In fact, up to 15% of patients can lose efficacy, and safety is clearly not well established with these agents. For that reason, I would suggest to you that you discuss with your gastroenterologist who's treating your Crohn's or ulcerative colitis. What is really important is what therapy works best for you, matching your specific disease to a specific medication. And also discuss with your physician the opportunity to look at other agents, that is, medication that may be natural medication extracted from plants and God-given elements of the earth, mushrooms, plants, leaves, which is featured in this month's Gastroenterology February 2017 review article on complementary and alternative medications for patients with inflammatory bowel disease. We have a lot to talk about in future discussions on what we need for patients with this disease. Iris and I are going to work together to make this happen for our patients and to broadcast this throughout this part of the world to let people know that there are opportunities for all of us to help these patients with Crohn's and ulcerative colitis. Thanks for joining us.